Hi, how's it going? My name is Jeff and I'm an occupational therapist and I work in the hospital often with patients who have had a stroke. And one thing that I ask my patients every time when I work with them from the beginning, throughout the rehabilitation to the end is how their sleep is going. And no matter if you've just had your stroke like yesterday, many weeks ago, maybe it's been many years. I think one thing we could probably all benefit from, regardless if you've had a stroke or not, is probably a better night's sleep. And when I ask my patients who've had a stroke how their sleep is going, they often report to me that their sleep is really poor. And there could be many factors that be the cause of this. For one, after having a stroke, your sleep is often interrupted, disrupted, and you may find yourself either like really sleepy and tired all the time, or you could be having trouble going to sleep all the way at the end of the spectrum, like having insomnia, or somewhere in between. And this is likely because, well, your brain has had a major injury, right? You've had a stroke and parts of your brain have lost their blood flow and now they're kind of like recovering and trying to get the best that it can from whenever you're not doing your daily activities out of bed. So that's the first reason, what has happened to your brain and the changes that are going on in the recovery process. Second is you may have some pain going on or even some tightness, and the medical term for this is spasticity. And so you may have noticed that your arm may be really tight, and especially for people who have had strokes, studies have shown that especially in the shoulder, a lot of pain may be a cause of a disrupted sleep. And this could be due to basically limited movement. So that's why I have like a lot of stretching videos and exercise videos for the shoulder. It's because some of you may be developing some shoulder pain. And so that could be another culprit. I highly recommend that you try to keep like a regular sleep routine. So try to sleep at the same time. Don't take too many naps. And other sleep hygiene kind of things that you can look up on the internet. I have some videos about that too, regarding how to get a better night's sleep, just in general, like more broadly and holistically. But today I want to talk about the question that I get often from patients, and that is, should you or can you sleep on your affected side? The short answer is it depends, but most likely yes. And I'm going to get into this, and yeah, you can click away and like, if you just want to know that answer to this question, yeah, you can go ahead and just go and sleep on that side. But I have kind of the reason behind it and more of how to do it too, like a demonstration and how to get onto the side and the do's and don'ts. So be sure you stick around for that. But on that subject, why many people, maybe providers, therapists, other people who've had strokes may tell you that they don't sleep on their affected side, maybe because due to pain. And one study showed that people who sleep on their affected side demonstrated more pain on that side as opposed to their opposite side. So does that mean that you should absolutely not sleep on your affected side? I am actually not a proponent of that because everybody is different. And just to be more kind of like patient-centered and patient-focused, more holistic, whatever you want to call it, I'm not going to just tell somebody that I work with like, hey, Mrs. Jones, like, no, you can't sleep on your affected side, and then just call it a day and they'll be like, oh, okay, and they accept it for that. Like, that would be changing your entire like sleep habit in the way you've been sleeping. Everyone has their own sleep preferences. Maybe some people like to sleep on their left side, maybe their right side, maybe they switch between their left and their right side. Maybe some people are more of back sleepers. Maybe some people like to sleep on their belly. Like my baby right now, like loves to sleep on his belly. And if I were to tell him, hey, you can't sleep on your belly, he probably wouldn't get a good night's sleep. So similarly, if I were to tell you suddenly, hey, you can't sleep on your stroke side, that may just be enough, even as like a therapist, like telling you on the internet to make it so that you get poor sleep. And some of you may even be like combination sleepers. You may toss and turn and just alternate and switch between all of those sleep positions. So my goal is to educate you guys and tell you that, yeah, you actually can sleep on the side that you are most comfortable in, but doing it with some kind of like awareness of what you should or should not do, what we call precautions. Because a lot of times I just see patients like when I work with and I would like wake them up for therapy, for example, and they're just like on their back because they don't want to deal with like sleeping on their affected side, or they don't want to kind of go on to their side because it may be too difficult, especially after a stroke. And they're probably not getting a good night's rest, or they're probably not getting good naps. When you sleep on your affected side, it all depends on how you do it. And just kind of some background is a lot of people after a stroke, they may be really tight, or there could be like really, really floppy. And so their arm either dangles off to their side, or their arm is like really tight and tense against their chest. Either way, the arm kind of just like rests in this position for a long time. And if you notice that you've like slept in a bed for a certain position for a long time, sat in a chair for a certain position, or even like watched like a really long movie at the movie theater, or I guess these days like binge watching Netflix for a really long time, you're not moving your body, and the body needs to move. Motion is lotion, and we need to stretch. That's why like yoga is so popular, right? And because like after a stroke, our arm is always in this position, well, yeah, it's no surprise that we're gonna have like maybe even like some pain develop basically from not stretching it out. And like our muscles, they actually can shorten and develop what's called contractures. So to combat that, one thing is to get better night's sleep with more optimal sleep positioning. And just like how in the exercises I show you, we want to kind of bring our arm up and out and more out into the side and kind of rotate it outward as the third one. You kind of want to also continue this throughout your day by promoting basically a stretched position while you sleep in these positions. Because if you kept your arm like this in all day and you slept like this all night, or when you take your naps, then yeah, you're probably going to develop pain even if you sleep on your arm or not. What the better thing to do is to kind of stretch your shoulder out and bring your arm out away from that and having it stretch out while you sleep. So that's kind of one benefit of starting to sleep in this position. Most typically, patients are probably going to start off on their back, right? And there's two extreme positions here. Typically, right after a stroke, some people may have really tight arm and it can be like really locked up against them. The second is the very opposite extreme of that would be very, very like floppy, and it just like isn't woken up and it's just not listening to you and it doesn't move at all. Some of you may be somewhere in the middle, and that's more along in the rehabilitation kind of recovery process for stroke, in which case you can get some movement back, and that's really, really good sign. How do you actually sleep on your affected side? First, I'm going to go over the don't of sleeping, and that's basically sleeping so that your shoulder blade is still kind of sticking backwards and you're chicken winging. It would be like your arm is really, really far back and your shoulder blade would stick out behind you. You do not want to sleep. Imagine that I have a bed on the side of me here and I'm putting pressure against my shoulder here. Imagine that my shoulder is just this far back. And if you were to actually feel someone else's shoulder blade, you would actually feel kind of that bone, that's what we call the scapula, sticking out. What you do want to do instead is sleep with your kind of back flattened so that your shoulder blade isn't sticking out anymore. So more or less your arm would be in front of you. So a good general rule is to sleep so that your elbow is in front of your body. So if I were to divide my body into a plane here, I don't want my elbow behind me or even just lined up with my body. I want it more or less to the front. That's kind of like a more general rule. For those of you therapists out there who are watching this, what you're looking for is so that the scapula is protracted and no longer sticking out posteriorly. How do you get into that sleeping positioning of onto your affected side? So assuming that you're starting from your back, and I would say 99% of people are probably on their back already, how you do that is actually pretty easy, because turning in bed is difficult when it comes to turning onto your non-affected side, surprisingly, because I have strength, for example, in this video on my right side, and my left side is my stroke side that is not moving as well, right? So that means I have good use of this side. So if I were to want to turn towards my stroke side, that would actually be pretty easy because I have real good functional use of my right side. And if I were to divide my body in half, the working side is the right side here. And I have kind of like the strength kind of like the motor you have, you will like kind of like as in an engine to move towards that side and initiate all the movements to turn onto the stroke side. It would actually be more difficult to turn towards my unaffected side because all the movement needs to start from this side, like on my left side of my body, and be initiated from and started from the left side here, which we don't have. So I'm going to talk more about how to sleep on your unaffected side in another video, because this video is more about sleeping on your affected side. And that can really depend, right? So some of you may have a stroke on your right side and you may prefer to sleep on your right side. So the same applies, it's just all the instructions are mirrored, and it's same still will apply regardless if you are left and right, by the way. So I don't know if you guys may be confused by that. Doesn't matter if you have a left stroke or a right stroke, which side is affected. The same kind of tips apply for you as well. How do I move towards my stroke side, like just slide? So the easiest thing to do that very thing, I probably was already doing that already, and that's to kind of bend my knees in what we call bridging. And basically bridging involves lifting like my bottom off the surface of the bed and scooting kind of a little bit at a time. It doesn't have to be like a really big movement. And to demonstrate that, the first thing you want to do is be aware of where your stroke arm is. You don't want to leave it like tucked under you and kind of scoot on top of it, because, well, one, that's gonna be bad for your arm. You don't want to like just cause any further injury. And two, just physically, it gets in your way. If something is in your way and you're moving against it, you're going to make your movement much more difficult. So why not work smarter, right? So the first thing you actually want to do is probably get the arm out of the way. Like not leave it down to the side, but just grab it. Pretend that it's more floppy, and I'm just going to get it over me. And next thing to do is to bridge, we want to bend our knees. Well, you can't really move so much with your left leg, but if you, those of you guys out there who have some movement in your left leg, just try your best to move it, even if it's a little bit. So this is part of the rehab and the therapy. Okay, let's just assume that's as far as I can get. Well, then I can use the right leg, the working leg, the non-stroke leg, to scoop it up higher. And I'm going to go into a bend position. Scoop it. And when I'm scooping, I want to try and use my left leg as much as possible. This leg is not just going along for the ride. I'm going to simultaneously try and still do as much as I can with my left leg and initiate movements with my stroke involved side. The right leg is just kind of picking up the slack and being a helper. So simultaneously, most of the effort is going to come, like 90% if I want to give it a number, from my left leg, and then like 10% will be from my non-stroke leg to kind of help it come into as much of a bent position as I can. And those of you who are maybe really, really tight in your hip and your legs, take your time with this, because this is kind of like a stretch, right? And it may, if you ever kind of bring on any pain, don't try to work through the pain. Like no pain, no gain does not really apply. Just take your time with it and do and work up to your pain. A little bit of soreness is okay. My leg is staying here because I'm cheating. In real life, after a stroke, people's legs will probably fall back down, right? Because they don't have the full muscle control of their lower legs. So if you have absolutely no control of your leg, then you can still scoop it up using the same way. Kind of something like this. Right? And one trick is you can hold your leg from sliding by keeping it kind of in front of it, like so. All we really need to do is make it so that we can initiate what we call a bridge and lift off the surface of the bed. And what I'm going to do simultaneously as I bridge is use kind of like my right working arm, the non-stroke arm, to push and slide myself towards my stroke side. I can either push with my arm like fully flat against the bed. Some of you may want to use just like your elbow. It doesn't really matter. If you have a surface to push against, that's even better. For example, like a bed rail, you can like push against that and use that to your advantage. The toughest of the movements is when you start from the very beginning. If you're like in the middle of the bed and you have like nothing to grab onto and you're just kind of in like open space within your bed, right? So what I'm going to do is simultaneously, and this is using all of my effort, my left leg and as much as I can, I'm going to use my right leg, especially where most of the power is going to come from. I'm going to use my right arm. I'm even going to try and use like my head. And right before we do our movement, let's just take a deep breath. Make sure we're remembering to breathe. And don't be afraid to do this in small movements, as many movements as you need to get yourself as close to the edge of the bed as possible. So there we go. 1, 2, 3. We're gonna just use the elbow. I think that's the most natural for me to bridge in 1. And then I can bring my head up to realign. I'm gonna do that again. I know that was the whole thing. This isn't my normal bed, so I'm like not even used to these pillows. I don't even know how they feel and stuff. It's really funny how like you get really used to things and you have a preference. And when you sleep in a new bed, everything is like foreign to you, right? Some of you may be experiencing that. Like if you're in the hospital right now, if you're at a nursing facility, if you're at a family member's home and not your very own bed, right? It's probably why you're also not getting a good night's sleep. So maybe like you want to ask your family member, hey, can you spend a little bit of money and make it so I'm not sleeping on a sliff board on the ground or something? So we're going to keep doing bridges until we're close enough to the edge. So I'm going to do that again. And the reason we're doing that is so that we can grab onto the edge of the bed, basically. And to practice bed mobility. It's also good exercise. Breathe. We're going to basically bridge. And just to show you again how I do that, I'm going to lift my hip off, use my elbow at the same time to push away, and kind of scoot towards my stroke side. 1, 2, 3. It kind of comes natural to you once you start doing this. You kind of figure out how to actually move your body. So take your time to problem solve and move yourself more optimally. It's kind of like if you've never done a bridge before, it kind of comes with practice too. So take your time with that. Try and roll onto the best as I can my stroke side. And I want you to actually begin your movement, what we call initiate. Initiate your movement now, mostly from your torso or your trunk. What we're kind of doing is kind of a twisting motion, like that. Kind of like if you imagine yourself wringing like a washcloth dry, right? Your torso is doing the same thing and kind of twisting. Now I want to check where my arm is again, if my arm got like caught up under me or it's just like in a funny position. Even want to just get it out of the way. Because what I'm going to do now is initiate movement from my torso and twist, and simultaneously with my working arm, now I can grab onto something. So if I reach, I can kind of grab onto the edge of the bed and use that as leverage. So now I'm basically going to I make it sound more complicated than it is, but basically turn your body towards your stroke side as best as you can. 2, I'm gonna reach, and 3. Okay. So, just like the magic of editing, I am now suddenly on my stroke side, and I probably was something like a little bit like this, right? So let me think. Something a little bit like this. So, how I talked about earlier in the video, you want to pay attention to where your elbow is. You don't want it to have it stuck right under you or behind you. Now, for those of you who have a helper, a caregiver, one definite no-no, even if you don't have one, when people try and help you, especially if you're a patient, and when you tell people to work with you, see, I can actually kind of feel it now. My arm is kind of like going numb because I'm putting so much pressure on it and it's just not comfortable. And some of you may or may not feel that after a stroke because you may have numbness, but those of you who do have some sensation, you can kind of feel it kind of going numb, right, so to speak. But what I was talking about was on the subject of not pulling on your arm. So never, ever, ever, ever let anybody pull on your arm. So don't ever let anybody pull on your arm to free it up from under you. Instead, you want them to, if you have someone help you, to kind of like push on the back of your shoulder blade, because that's where the really like your shoulder, all your muscles and joint is. And I mean, it's not to say you can't ever pull on your arm. What I'm basically saying is don't only pull on your arm. You want to kind of support it at the same time. So what I don't want to do is like reach around and pull on the arm and pull the arm out from under this patient. Like, no, 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 don't do that. What I want to do is encourage them and have them practice them, have them do it themselves, have the patient initiate the movement and kind of roll away from it and kind of offload some of the weight if they can, just to start. And then from here, I can kind of, one hand, for example, goes under the arm to support it kind of at where the elbow would be, like here. And then the other arm, I can kind of just push on the shoulder blade. And just to show on camera what that would look like, if you were to pretend that the patient is sleeping on this side and putting their weight onto this side and it's mirrored, what it would kind of look like is the shoulder blade would be right here. I don't want to just pull on the arm like that. What I would want to do is kind of gently push on their scapula, their shoulder blade, as I simultaneously bring the arm forward. How do you free your arm from under you if you are by yourself then? Well, one thing you can do is basically get the weight off of it and roll away from it. So a little bit like that. So now I actually feel my elbow being freed and I can actually move it out of the way. So now I can kind of help it with the other arm. I know I said don't pull on the arm. I'm not really like pulling on it. I'm just kind of pushing it from my elbow. And if you can, try and move your stroke arm as close as you can from your shoulder as you can, like from your elbow. Always try and move it from as close as you can, like the elbow, as opposed to like pulling on your finger, for example. And so now I can actually free it and move it out of the way. And this is actually a really good stretch anyways to begin with, and have it just kind of like I'm making a snow angel and I'm like bringing my arm up. Now that it's out of the way, my elbow is like further away from my chest, I can kind of turn back onto my side fully again. And one way I can help myself get into that is use my strong arm again. Also try and use your torso as much as you can, because you do want to practice your twisting, kind of wringing of the washcloth motion, but you can use your arm as a helper as well. It's kind of like a whole body movement really, to kind of turn yourself more fully onto your side. How can you make yourself even more comfortable? One thing you can do is have pillows. So one thing that people find pretty helpful is, say, having a pillow for here to kind of close up the gap for your arm. I don't have a second pillow right now, but if I did, another good place to put it is in between the knees. So I'm just going to use this pillow here. Imagine I didn't have a third pillow. So it would be something like that. Another thing I like to do with my arm that has had a stroke is I like to kind of bring it up and tuck it under me too. That's also pretty comfortable, like that. And on that note, if this is too extreme of a position for you to fully go on your side, one really good stretch actually is to be in kind of in between this position. Here I'm not fully on my side and I'm not fully on my back either. I'm kind of like in between at like a 45 degree. And this is a really good stretch because it gets my arm, if you remember the positions that our arms kind of get locked up from, we want to get it away from here, right? So we can bring our arm out and make a snow angel and kind of stretch it out. And one benefit to having our arm closer to the headboard is it kind of also works on the rotation part and opening our arm out as well. So in summary, the question that patients often get, can you sleep on your stroke side? It's not an absolute no. It can be a yes, depending on how you do it. And the big no-no is to avoid sleeping with your shoulder blade back and your elbow behind you, or to sleep directly on top of your arm, have it slightly in front of you, or to have a more modified version and instead of sleeping directly like on it and completely on your side, rotate a little bit so that you're almost lying on your side. And how you position your arm is really, really important. Having it so that it's to your side and out, and how your hand is placed is also important. So also I encourage you to try bringing it upward as well, so that your hand is closer to your head. Because I don't know about you, but that's a pretty comfortable for me to sleep in anyways, right? So hope this helps. Thanks for watching. If you found this video helpful, be sure to give this a thumbs up so that I know that these kinds of videos are helpful for you guys and to make more of these, and to subscribe to my channel so that you get notified when I release videos for healthcare, rehab, and exercises related to conditions such as stroke.